Communicating with hearing impaired person or patients. And this is the topic that we are going to discuss in this video. I'm Dr. Kavita, Professor, Madras Medical Mission, College of Nursing, Chennai. Communicating with hearing impaired patients, the topic that we are going to cover in this video. Successful communication requires the effort of all people involved in a conversation. It includes both the receiver as well as the sender to talk about properly the message what we are going to discuss each other. When one person is having a hearing impaired and the person communicating with him should be careful, and it is crucial that whoever involved in the communication process consistently use good communication strategies. Before going into the techniques or tips of communicating with the hearing impairment person, we should also understand that hearing impairment, deafness, or hearing loss refers to the inability to hear things either totally or partially. Hearing loss is the reduced ability to hear sound, whereas deafness is the complete inability to hear sound. Deafness and hearing loss have many causes and can occur at any age. We all know there are different types of hearing loss that can be either conductive hearing loss, sensory neural hearing loss, or age-related hearing loss. A person with the conductive hearing loss are being given with the hearing enhancement devices called as the hearing aids. There are different types of hearing aids are available, which will be a separate topic discussed. Whereas other people, they use different sign language or any other technique to communicate that we are going to discuss. Sign language is a visual language which is not a written language like English. Teaching a visual language is completely different from teaching a written language. Sign language itself has its own and unique grammar rules and foundation because it is strongly influenced by people's cultural attributes such as facial expressions, gestures, and usage of space, and many more. The language itself may seem superficial from the outside, but if we sink deeper, there is much more to the language itself. That goes well to any sign language in any country all over the world. And there are different types of assistive devices are being invented or used due to the advancement in the technology. Few are light alerting systems, which will enable people to know when the doorbell is ringing or a baby is crying, example of such. These light alerting systems can be used when a hearing impaired person is left alone at home or in offices or in rooms. So whatever the sounds they may not hear, that will be converted into the light alerts which they'll be able to see and interpret. Special sound systems also help people in hearing. Examples in theaters or in other places of worship where messages are being given. Special sound systems which can be used to make these persons understand the message. This sound alert special sound systems can be used in places where there is competing noise. And closed captioning is the one which is being used in many television programs with the dialogue shown as the visible text. And telephone communication devices also nowadays enhanced the opposite end, the people, whatever they speak, that will be converted into the written language to the hearing impaired person. And this is the advancement in the technology. And these assistive devices also help the person to understand the communication. There are a lot more assistive devices are available which can be used. Another technique of communicating with the hearing impaired person is the lip reading. And mostly people born with hearing impairment may be trained to use the lip reading. and it is important skill for people who have decreased hearing. It is particularly important for people who can hear but have trouble discriminating sounds, typically those with age-related hearing loss. Observing the position of a speaker's lips allows people to recognize which consonant is being spoken. Because people whose hearing loss affects high frequencies are unable to understand consonant sounds, lip reading can significantly improve the comprehension of speech. Lip reading and other strategies for coping with hearing loss are sometimes taught by hearing professionals in a program called oral rehabilitation. In addition to training in lip reading, people are taught to gain control over the listening environment by learning to anticipate difficult communication situations and modifying or avoiding them. This will be trained or taught during the oral rehabilitation program. So as a nurses, we come across many type of patients with many impairments and morbidities. One among them is the people with the hearing impairment. Whenever we see a person with the hearing impairment, we should understand them first, and we should make little conscious effort to communicate with the hearing impaired person. Some patients speak and speech read or lip read. Some use sign language. Some may communicate by writing notes. Some bring someone with them to interpret. So identify what type of what pattern of communication is being used by the hearing impaired person. Understand that and start communicating effectively with the hearing impaired person. Here, to give you some of the important points that we should remember in communicating with the hearing impaired person. Suppose we are a nurse working in a reception and waiting areas of the clinic, or if you are a OPD nurse, or you are in the consultation room, or when you are taking the patient for consultation at the reception and the waiting areas, understand that these areas will be very noisy because many people come and go and many will be crossing the patients. Many instructions may be given. So these places usually will be noisy. Patients with severe or profound hearing loss will not hear shouted instructions or staff calling out their name. In these difficult situations, there are certain things that we can modify to communicate with the hearing impaired person. Use a number system or a signboards to inform them. In many areas, displayed signs will be available, which will make the hearing impaired person better to understand what to be done next. If you know a patient is hearing impaired, make sure the consultation takes place in a suitable setting. Keep a note on the patient's file with the details of any communication requirements like a technique, a language, or the lip reading, and any other modes that the patient follows, so that who's in contact with the patient will understand the person's requirement for communication technique. In the consultation room, there are certain special things that we should remember is give the patient privacy during the consultation. Minimize distractions. Try to avoid any other activities. When the patient is talking to the doctors, avoid setting the trays or going here and there or using any other monitors or any other instruments. This will distract the person's communications. Reduce background noise. Ensure that the room is well lit. Because people may use to follow the facial expressions or they may observe the lip reading of the other person. If the room is well lit, that will make sure the communication is good. Remember that face is an essential communication tool. So while communicating with the hearing impaired person, make sure you face the patient, not the interpreter or caregiver. Remove any mask or face shields. Do not have anything between the lips or chewing gums or eating. All this should be avoided when communicating with the hearing impaired patient. Have the light on your face rather than on the person you are talking to. Support your speech with the facial expression wherever you can, but understand and use the local culture of gestures, expressions, and accepted physical contact with the patient. Some important tips to communicate among these patients are: put up a sign in waiting room asking patients to inform if they have a hearing impairment and whether a sign language interpreter is available. Do not rely on being able to see a hearing aid. Not all patients with a hearing impairments wear these. And nowadays, the hearing aid what the patient is wearing also will not be visible because hearing aids has become very smaller in size and different techniques, technological advancement are used in designing the hearing aids. Don't rely on looking for the hearing aid. Face the hearing impaired person directly on the same eye level in good light whenever possible. Speak normally, not too fast or too slowly. Certain sounds can be distorted or lost if speech is rushed or slowed down too much during the conversation. Use the same speed in communicating with the hearing impaired. Do not talk from another room or behind the person or away from the patient. Stand in front of them near good distance and talk to them. Not being able to see each other when talking is a common reason why people have difficulty in understanding what is said. Speak clearly, slowly, distinctly, but naturally, without shouting or exaggerating mouth movements. Shouting distorts the sound of speech and may make speech reading more difficult. Use short and simple sentences in communicating with the hearing impaired patients. Do not exaggerate your speech or lip movements. Since the patient is hearing impaired, don't exaggerate any expressions on your speech. Talk in your natural tone, in your natural speed, with your normal expressions, like communicating with the other person. Say the person's name before beginning a conversation that gives them the close attention that they are the one being addressed. This gives the listener also a chance to focus attention and reduce the chance of missing words at the beginning of the conversation. Avoid talking too rapidly or using sentences that are too complex. Use a simple sentences in communication. Slow down a little, pause between sentences or phrases, and wait to make sure you have been understood before going on to the next topic. Keep your hands away from your face while talking. If you are eating, chewing, smoking, or any other movements are being done at the face while talking, your speech will be more difficult to understand. Beards and mustaches also interfere with the ability of the hearing impaired to speech read, especially when they use the technique of lip reading, because this will have certain interference or misreading of the movements. If the hearing impaired listener hears better in one ear than the other, try to make a point of remembering which ear is better so that you will know where to position yourself. It is always advisable to stand near the better hearing ear than the opposite end. Be aware of possible distortions of sound for the hearing impaired person. What kind of sounds that will distort the communication when talking, using certain tools in the hand and talking, or using any click sounds or bells which may distort the communication. Some people with the hearing loss are very sensitive to loud sounds. This reduced tolerance for loud sounds is not uncommon. Avoid situations where there will be loud when possible and remove the sounds before that communicating with the hearing impaired person. If the hearing understanding a particular phrase or word, try to find a different way of saying the same thing rather than repeating the same original words over and over. This will make the person uncomfortable, or this will make the person fatigued to communicate with you. Acquaint the listener with the general topic of the conversation. Avoid sudden change of topic. For example, if a nurse is giving a discharge advice to the patient, you may divide the discharge advices into different topics. For example, wound care, medication schedule, follow-up visits, something like that. First, tell the heading what you are going to talk. The topic should be informed first. That will give them the more concentration, or that will give them the little pause what we are going to talk about it. Here we can say first the wound care. I'm going to just tell you the points which you should remember in carrying your wounds. So this little caption will help the person to understand and focus what will be taught to them in the next sentence. If the subject is changed, suppose if you are moving from the wound care to the medication schedule, tell the person what we are going to talk about now. So we discussed about the wound care. Next we are going to talk about the medication schedule. In medication schedule, this thing shape. So that what medication schedule will give them the focus to their attention in the content being taught to them. In a group setting, repeat questions are key facts before continuing with the discussion. If you are giving specific information such as time, place, or phone numbers like that to someone who is hearing impaired, have them repeat the specifics back to you before that they could confirm it, because many numbers and words sound alike. So ensure that the person repeats back to you what is being told. Whenever possible, provide pertinent information in writing such as directions, schedules, assignments, etc. The important point can be written in the typed matter or in the written content. Recognize that everyone, especially the hard of hearing, has a harder time hearing and understanding when ill or tired. Pay attention. A puzzled look may indicate misunderstanding. Tactfully ask the hearing impaired person if they understood you. Ask leading questions so you know your message got across the person. Take turns speaking and avoid interrupting the other speakers. This is possible when there are more than two people are talking to the hearing impaired person. One may cross the other person. Make sure one speaker completes his content before the next one starts the conversation. Encourage enrolling in oral rehabilitation classes with a hearing impaired spouse or friend. Rephrase rather than repeat. Communicating with the hearing impaired person is a little tactful technique which will make the communication more effective and clear. These are some of the references I made in preparing this content. Have a good communication and the useful communication with the hearing impaired. Have good with communicating with the hearing impaired people.